When I look back, do I have clients having a hard time going along with it? And I chuckle to myself when I say that, because when I first started to pursue this, clear back in 1998, 99, my bosses at Gunnison go, you can go do that if you want, but we are not going to support that. You can pay for it. You can do whatever you want. Take your vacation, because you live in a rural town. Nobody here is going to do acupuncture. It's two-way out there, things like that. And really, when I look back at my career and now my career at Colorado State University as a clinical instructor and things, I go back and I can honestly look straight into this camera and I can say, I cannot remember a client turning me down. Within 6 months period of time, acupuncture was the most requested modality we had at that practice in Gunnison. And I remember doing horses in the back, and they belonged to old ranchers there. The ranchers are bringing the horse, and my bosses came out who became very good friends of mine, and they go, why are you doing Curtis's horse? It's his ranch horse. And I said, because here, let's ask Curtis, why are you doing the horse? And Curtis goes, because it makes him feel better. And I will do anything I can to make this creature feel better, because my life depends on him. I love this horse. And so honestly, a short answer would have been no, but I want you to understand that I can't remember a client ever going, no, I'm not going to do acupuncture. If it's going to help my patient, if I'm going to get pain control, if I'm going to get any of that, then I'm going to go for it. So why did I choose Dr. Robinson Narda's courses? And I have since day one. And I'm going to add to that question and go, why do I only recommend one, right? When clients call me, when students go through, I'm going, here is the situation. We have many courses out there. There's getting to be more and more of them. To me, there's only one course. When I look at acupuncture, and I'm not criticizing the other courses, don't get me wrong, but now I deal with veterinary students. So they spend 4 years memorizing the nervous system, memorizing nerves. What I get so passionate about this is when I look at this body and I see the nervous system. I mean, that thing that came to Denver one time, Body World, where you could go in and see the nervous system, it even amplified what we're doing more and more and more and more. I am interested in going after the nervous systems that I have learned and memorized. And that's why I tell the students that there is no other course right now in your career. If you practice 20 years and you want to go learn something different, then you go out there. But this is the course that's going to teach us neuromodulation. It's going to amplify the neurology that we spent all that time learning. It's going to tell me how to talk to the brain and how to talk to the nervous system, how to talk to the autonomics. And to me, that's where we go. It's my personal belief. That's where I go with it. And that's what I want to do. And I just think it's just a riot to know that I have stuck a nerve in the leg that I have memorized when I was a freshman or a first-year veterinary student, and understand now what the track is, where it's going in the cerebrum, where's all the things that it's doing and all the hormonal influences. I could go on and on and on and on when I do that. But the big thing is I just think that this is where, to me, all acupuncturists need to go to this course, and then they can go and do other things if they want to.